In June 2016, physician-hastened death will be legal across Canada. New laws need to be made to protect our most vulnerable citizens. Regulations, also known as safeguards, are needed to regulate physician-hastened death, to prevent abuse, wrongful death, and to protect the safety and right to life of all Canadians. To protect vulnerable Canadians, we propose a federally regulated centralized system with strict safeguards, a system which would be consistent across the country. But first, let us set the context to this issue. According to the Canadian Criminal Code, it is illegal for a doctor to help a patient end their life. In February 2015, the Supreme Court released its decision that the complete ban on physician-assisted dying is unconstitutional for a competent adult person who clearly consents to the termination of life and has a grievous and irremediable medical condition that causes enduring suffering. The Supreme Court of Canada gave Parliament until June 2016 to create laws to regulate physician-assisted dying. But before we go any further, let's clarify some definitions. We need to make a distinction between practices that hasten death and those that do not. There are two types of physician-hastened death. There is patient-administered physician-hastened death, known to some as physician-assisted suicide. There is physician-administered physician-hastened death, known to some as euthanasia. It is important to note that physician-hastened death is not part of the spectrum of end-of-life care known as palliative care. According to the World Health Organization, palliative care improves the quality of life of patients and family facing end-of-life problems. It intends to neither hasten or postpone death and offers a support system to help patients live as actively as possible until death. Palliative care does not seek to hasten death. Unfortunately, in Canada, we currently have a lack of public understanding of what palliative care is and inadequate access to this valuable service. A patient whose end-of-life symptoms are not adequately addressed may be vulnerable to feeling that a hastened death is their only choice. To be vulnerable is to have diminished defenses. Many Canadians do not have the resources, such as income, education, healthcare, and family and friends, to protect and promote their safety and interest. Psychosocial factors such as grief, loneliness, and mental illness may also make a person vulnerable. A vulnerable person can be young or old and from any background. Their vulnerability may not always be easily identified. They may be motivated to seek physician-hastened death by factors not necessarily related to their medical condition. A vulnerable patient may be experiencing grief and abandonment. They may be afraid of burdening society or their loved ones. They may not be aware of other treatments that can help them with their suffering. They may be receiving pressure from others around them to prematurely end their lives. Physician-hastened death must exist alongside a strict and carefully designed regulatory system. The Supreme Court of Canada recognizes the need for a properly administered regulatory regime. It emphasizes that adults who may be vulnerable to committing suicide in a time of weakness should be protected. Unfortunately, even the strictest and most well-informed safeguards would not be able to prevent all cases of abuse and error from physician-hastened death, but at least it would reduce the numbers of wrongful deaths that can potentially happen. To protect vulnerable Canadians, we propose a system of safeguards that would include a system of centralized access, federal regulation, and strict eligibility safeguards. A centralized and federally regulated program would prevent a patchwork of laws and rules that vary from province to province and hospital to hospital. There are currently several federal programs existing in relation to health matters, such as Vancouver's Safe Injection Site, the Food and Drug Act, and Veteran Affairs Canada's Health Insurance Program. This program would first involve physicians with specialized training to assess for capacity in this context. Secondly, a multidisciplinary team which would counsel patients and attempt to identify and address vulnerabilities that may be triggering the request. Finally, an independent review body with authority to approve or deny the request. Specialized death certificates to properly document all cases of physician-hastened death will be needed to ensure transparency and support ongoing research. Appropriate sanctions will be required to ensure accountability and to punish criminal acts and abuse of physician-hastened death. Patients should be able to self-refer to this program to improve access for patients who do not have physicians, and this would also protect the conscience rights of doctors who do not want to participate by referring. The system should be distinct from palliative care and the regular healthcare system to improve transparency and clarity for patients. Finally, strict eligibility safeguards are needed to ensure that physician-hastened death is a rare exception and not regular practice for alleviating suffering. It needs to be restricted to patient-initiated request, consenting adults, and terminal illnesses with limited prognosis. Legislation that will dramatically change the care and the ethics of dying in Canada will be made in June 2016. We need very specific and well-defined laws to ensure that physician-hastened death is not abused in our compassionate healthcare system. June 2016 is just a few weeks away. The time to speak up is now. We need a federally regulated, centralized system that is consistent across the entire country. You can advocate for vulnerable Canadians by writing to your MP about the need for a federally regulated system of physician-hastened death that has strict safeguards and is separate from palliative care and regular health care. Please read the Vulnerable Person Standard and sign their petition on the website. This standard is a list of safeguards created by a group of ethicists, medical professionals, lawyers, and advocates. The document is supported by many different Canadian organizations, including the Council of Canadians with Disabilities. Thank you for taking the time to watch this video. All patients, whether they desire or reject a physician-hastened death, have equally important charter rights to life, liberty, and security of person in the transition to death. Let us protect these rights.